Does a full hip replacement require a hospital stay? And the answer to that question is, if you're a Medicare patient, yes. If you're not a Medicare patient, no. My concern about hip replacements that does not apply to knee replacements is that we do have more issues with blood pressure. And in the event that you're in that 5% group that needs a hip replacement, currently we can't really easily give that to you in a surgery center. So for that reason, my preference is to be only for 25 hours in the hospital with a hip replacement. Yes, those are excellent questions. So I think you're going to get differences of opinion from different surgeons, but I generally say that once you have a hard time doing the things that you like to do because your hip or knee is preventing you from doing that, you can consider having a joint replacement. We like to try all of the things that don't involve surgery first, if you're willing to try them and be patient. But there's some patients where they have to, get back to work quickly, they're having a hard time, or they're not willing on the cost side and the time side. They feel like they're young, they're healthy, they just want to be done and fix it. It's okay to go that route. My preference is to usually try the easier things that are not surgery first. Then the second part of your question is, in terms of activity, almost anything that does not involve running and jumping is perfectly okay after you've had a joint replacement. I use the analogy of Bo Jackson for people that remember Bo Jackson, who was the football and baseball player who had a hip replacement at a young age and continued to kind of beat up and had to have it redone shortly thereafter. We don't worry as much about that, but I think generally speaking, any exercise that's not involving high impact running and jumping. The other thing that I like to tell people is if you like to ski or snowboard or do things where there are other people around where you might fall, is that unfortunately, if you have a joint replacement and then you break your hip or your knee, it's very difficult to get you back to being excellent if you do break your leg after having that kind of surgery. So those are kind of the general guidelines I give.